and you will see a sphere pruritus as shown here. Okay, I don't have this. Yeah, it's working. So pruritus, you will see the thick skin, alopecia, self-trauma, or skin scaling. So, but this disease is not is really reportable in a number of different states. Okay, so diagnosis. Let's start with Sarcoptic scabies, boring mites. So, what will be your plan for the diagnosis of these mites? Natodaris. Sorry? Deep skin scraping, yes. So these mites hard to find because they are boring mites, and you will be do the deep skin scraping. So what else you can do in the deep skin scraping? What is what strategy you will be adapt? More than one location. So you have to do it in multiple scraping. Because a deep skin scraping, sometimes you will not identify, you will be get the negative results. But if you do it in a multiple locations, then you will be get more positive results. Treatment of choice: imidacloprid and moxidectin is the drug of choice for the treatment of the Natodaris catty. So, Demodex, very, very important mange mite. This infection is normally seen in the companion animal as well as in the large animals. And this parasite or mite will live into the hair follicle and the sebaceous gland of the mammals. So, what happens once they live there? They destroy the hair follicles, cause the nodule formation, and also associated with the immunosuppressive condition. So they are very specific to the host, and they are not zoonotic at all. But they are very, very important, and you will see these Demodex case in your daily or normal practice in the clinic. So the most important species, as I said, they are host specific. Demodex canis, they infect dog. Demodex catty and gotti, they can infect cat. Demodex bovis, as the name suggests, in cattle. Ovis and aries in sheep. Capri in goat. Cabali in horse, and Physiolidae in pig. So the clinical feature of this disease is really important. You have to understand these features of this disease. They should be a localized as well as generalized feature commonly seen in dogs. So what happened in the case of before we go into the general features, just again we can little bit discuss about the life cycle. So what is the difference here in the life cycle of Demodex? This is the only mites have a little bit different type of life cycle. Who going to tell me what that difference is? Anyone? So think about hair follicles, right? So they will be stay in the hair follicle, right? So the other mange mites, you do those who are boring mites, you do the deep skin scraping. In the case of the non-boring mites, you do the superficial skin scraping. But in this case, either you can squeeze these spicules in where these parasites are, or you can remove the hair, right? So this mites puncture the epithelial cell lining, hair follicle, and sebaceous gland for feeding. So they will be normally reside into these areas of the hair. So all these stages will be contained in the hair follicle in this group of parasite. Not boring, not non-boring, in the hair follicle. Okay, so clinical features, general features, the transmission commonly occur from dam to puppies during the suckling period, not through through the skin, not through the milk. So at that time, they will be the dam will transmit the disease into the puppies because if they have a skin infection, they can transmit it, not through the milk. And this mange is most commonly seen in dogs under the 12th month of age, and the cases occur in short hair breeds, and the lesions are first seen in the eyes, muzzle, or plantar region. So eyes is the most common area where this infection is start. How? So localized and generalized Demodex. Localized, few areas of the bodies are affected, and mostly the eyes will be the area where this infection, or the face is the area where this infection start. And in the case of generalized form, more than 5 areas has been infected, and you will be see some infection in paw region, or you will see the pododermatitis there, and erythema, pustule formation or thickening of the skin, and the relapse are common. So how we can differentiate these generalized as well as localized form? So first we can start with the localized form, that where the young dogs, they will be show the raccoon face. It's very important. So you should be remember that one in the localized form. You will see this raccoon type of face. It normally occur during the nourishing period, is mostly recover once they are mature. You will be see 1 to 2 spots on the face or on the eyes, and that's why we called it raccoon face. And you will see alopecia or erythema, but you will not see the pruritus. So this is the localized form of Demodex mange. In the case of generalized form, young and old dogs has been infected, and they cover the large area of the body, and these are some of the breeds. As an example, is infected with the generalized form, and the disease is also associated with some underlying systemic diseases or deficient diseases. So what the generalized form will be look like? There's a 2 type of generalized form: squamous form, pustular form. In the case of the squamous form, it will be more mild, and you will be see folliculitis with the patches of alopecia or scaling or erythema, as shown here in this picture. In the case of the pustular form, it will be more severe, and that will be further responsible for the secondary bacterial infection and deep pyoderma and peripheral lymphadenopathy. So these are the two forms, generalized form you will be seeing in the case of a Demodex mange infection. So it means that infection is always start with the localized form, and you will be see the lesions on the face of the dog. So the treatment plan. So in the case of in dog, isoxazoline, these are the most like miracle drug, I would say, and the treatment of choice for the Demodex infection. Fluoroner, that is given in a chewable tablet, and they in the dogs, and they reduce these mites infection up to 100% day 56 and 84. Ofoxolaner is also isoxazoline group. That is also recommended for dogs to reduce these mites, and also this will be reduce the infection up till 100% on day 84. So these are the two most important drugs you can use to treat the Demodex mange. So other treatment plan will be the long-term use of ivermectin, but this ivermectin can cause neurotoxicity in border collie. So that's one of the reason not to be used in border collie. These ivermectin, they cause the neurotoxicity. So Demodex mange in cat, just keep in mind this Demodex in dogs is a very, very severe infection. In the cat, it's rare, maybe it's not is go unrecognized, and this disease, if you see the infection, that is maybe associated with dermatitis of the head and ear canal. So it means that again the infection starts from the head and ear. All age group or breed of cat, and it may be localized or generalized similar to dogs, but it is very rare as compared to dog. So if you will be see the clinical feature, as I said, it will be start from eyes, head and neck. You will be see some scale formation or erythema, folliculitis, or pruritus that will be seen in these here in this number of cases. And the treatment plan will be again isoxazoline is the drug of choice, but you can also use microcyclactone, ivermectin group, and lime hot sulfur dip. So these are the three treatment of plan, but isoxazoline is the best drug of choice for cat also. In cattle, that is associated. Yes.
Is there pruritus with a generalized form in dogs?
It will be generalized form in the dog. You are saying? Yes. In generalized form. Yep. You will not see pruritus in the localized form. Yep. So in the case of Demodex mange in cattle is associated with the stress condition with pregnancy and or lactation period. You will be see the nodules formation on the lower neck, shoulder and arm or brachet region, and also this is non-painful condition. The animal will not feel any pain. Nodules with the toothbrush like exudates will be seen, and spontaneous recovery is very common. And if you need to treat the animal, trichlorophon is the drug of choice. In the case of sheep, Demodex ovis is overlooked, but probably the most common cause of Demodex mange in sheep. But Demodex aries appears to be confined in the area with a large sebaceous gland, for example, like prepuce, vulva, or nostril. Clinical features: you will see the pustule formation and nodules, and there may be a loss of wool in a number of different cases. In the case of goat, Demodex capri, they cause the nodular dermatitis in dairy goat, and the clinical features is most common in young pregnant does. Generalized and severe lesions has been seen. You will be see the nodule formation, that in these nodule formation you will see some thick waxy gray or white material, hair loss, and the thickening of the skin. In case of horses, the most common species is Demodex caballi, is harmless parasite of the sebaceous gland, but the other species like Demodex equi is most common, and they cause a more severe lesions like alopecia, scaling, and they are further associated with the corticosteroid therapy and the excital drugs are not very much effective. So in the case of pig, Physiolidae, Demodex physiolidae is the most common parasite cause this disease, and you will see the hair loss, thickened and reddish color skin, large abscess formation may be developed in the animal. Okay, so diagnosis. So now we talked about the diagnosis of boring mites and non-boring mites. What we're going to do here? How will we do the diagnosis in the case of Demodex? Sorry? Yes. So here you will be most probably, if you do the scraping, it should be harder, and you have to try to remove the hair, because you will see the Demodex within the hair follicles. So that is the best technique here, and maybe you can also squeeze the pustule formation, which is developed due to the Demodex infection, and then you can also see some, and you will take this hair follicle from there, because in the pustule formation that will be covered the hair follicle, and if you squeeze that one and remove the hair from there, then most probably you will get these Demodex. So how you will differentiate Demodex with the other mange mites? What is the main differential point here? Sorry? They have a sausage shape. There's very clear difference you will see in the larvae. Nymph and adult. So how you can differentiate the larvae with nymph and adult? Sorry? Number of legs. So larvae has a 3 pair of legs. Nymph and adult has a 4 pair of legs. Okay, Kelitella. So that is called a walking dandruff. Is common in dogs as well as rabbits. You will see these mites in the rabbit colony. So if anybody remember which mange mite we covered yesterday that can infect a severe otitis in rabbits? Sauropti caniculi. Yes. So Sauropti caniculi. So here, as I said, is called walking dandruff. You will see the pruritus and the transmission of one of the virus called Maximatus virus, and it's also zoonotic. Once it's, as I said, is zoonotic, so it causes is infection in human. The mites are you will see that these might feed the blood, lymph, and serum. Brain-like dermatitis, and also you will see the scaling formation and the mild pruritus with dorsal distribution. So these are the most common clinical features you will see in human. So anyone remember yesterday's lecture? Which mange mites is zoonotic to human, cause disease from dog to human, and very similar type of signs? So you say yes? Sarcoptes. Sorry? Sarcoptic scabies. What variant is that? Canis. Yes. So that is zoonotic to human. Great. Okay, so treatment of Kelitella mange is the ivermectin drug work perfectly in this group of parasite. The key is not only to treat all infected pet with the ivermectin, but also treat the environment with pyrethrin. Clothes, beds should be washed thoroughly. Household should be vacuumed, and all in contact with the host should be treated. So it means that you have to treat the animal with ivermectin and with the pyrethrin clean the environment. So here will be covered the two important ear and nasal mites. Autodact is the most common ear mite, and pneumocystis is the nasal mite. So Autodact cynatus cause infection on the external ear canal of dog, cats, and foxes. They are non-boring mites. They live into the external ear canal. So keep in mind this species is always, you will be see these mites always in the ear canal, not the other part of the body, and is common in the young animals, very similar to croptic mange, and highly contagious. The cat can be asymptomatic carrier in this mite. So the clinical features usually occur in both ear. Ear can be canal is moist. You will see the wax formation, purulent blackish debris as shown here, and that is a resemblance to the coffee ground shape or coffee shape, dark brown in color. You will see the pruritus. Host may be developed hematoma due to the wild shaking of the head, and sometimes you will be see the secondary bacterial infection in this case. So lesion will be sometime extend toward the head, neck, and trunk, but most common lesions you will be see in the ear, and if they move toward the head, you will see the pustule and crust formation in the head, neck, or trunk region. So diagnosis, you will be identify these mice always on the ear swab, and because they are very resemblance to the croptic mange mites, usually present at high in number, easy to find with the otoscopy. So you will be look it into the ear canal with the otoscopy, and you will be see the white color mites inside. And also, if you further look it into the microscope, you will be look it into the larvae. They have a 3 pair of legs. Nymph and adult has a 4 pair of legs. So treatment for this Autodact cynatus, milbemycin and ivermectin, they will be normally directly applied into the ear canal. The first treatment of choice is thoroughly clean the affected area, like ear canal should be cleaned properly, and then the topical medication will be applied into the ear canal, and then that will be most probably reach into the infection site. So Pneumocystis caninum, these are the nasal mites, very common in dogs. Normally you will be see the clinical lesions features like coughing, chronic and reverse sneezing. You will be see the rhinitis, and as head shaking is very common, and facial pruritus is very common, and impaired sense of smell will be seen in the dogs. So for the diagnosis, rhinoscopy is one of the option you can adapt. You can also take the nasal swab or flushing of the nostril. You may observe the mites in the nasals as seen here. You can see these mites are moving around. Once they sneeze, these mites will be come out, and you can see there. And the drug of choice is the microcyclactone, ivermectin, selamectin. The differential diagnosis is sometimes there is some other infection like fluke infection, lung flukes, or some tumors or some respiratory diseases. You will be see a very similar type of signs in those diseases also. So these are some of the differential diagnoses in this disease. So poultry mites, Demonas gallini and Arthronus salivarian. So these are the two most important poultry mites is we will going to cover today. So Dermanus gallini is a poultry red mites. So most of the time this might spend in the avian host in the dark crakes and some of the nest in the poultry farms, but the adult and nymph will be attack on the bird at the night time to feed the blood. So it means that the larval stage normally present in the form, not in the host. But once they convert it into the nymph and adult form, then they can attack to the birds, and especially on the night time to be take the blood. So you can see here they will be normally resides into the number of cracks in the form, and then they can attack to the birds once the nymph and adult will be attacked to the birds to get the blood. So rapid population growth can be raised to massive infestation. So in the case of Arthronosis salivarian, these are the northern fowl mites. They spend entire their life cycle on the avian host, but in the case of Dermanus gallini, they will not spend entire life cycle in the host. Nymph and adult will be spent there. They will be attack the host to take the blood in the night time. Arthronosis salivarian, they reduce the productivity due to irritation and anemia. They are also responsible for the transmission of fowl pox or Newcastle disease, and sometimes they bite the birds and feed to the human. Yes. Other mites?
The other mites that we talked about, do they feed on blood as well, or no?
They will. Sorry, say it again. I can't see.
Do the other mites that we discussed feed on blood?
No. This Dermanus gallini, that is the most common feed blood to birds. This is the only one, right? Okay, so any question? No? Anyone has any question? Any? Okay, so now we can't able to use the point solution. We can try. I mean, how you can answer it? Raise your hand. Okay, so let's try with this one. What is the common name of sarcoptic scabies cause disease in dog? A, B, C, or D? Sorry? A. Okay, great. Okay, so you are doing a superficial skin scraping applied to the skin surface can be used to diagnose which one of the following mange mite. Superficial skin scraping. Demodex C is not possible. What about the B? Any of them says B? D? How many says A? Great. Okay. So, what is the common name of sarcoptic ovis cause disease in sheep? A. B. C. D. Okay, how many says A? Okay, so you are right. So sheep's scab. So just think about sarcoptic ovis. Ovis, we are talking about ovis. Ovis is sheep. So sheep's scab. Okay, so you have identified the falling mange mite. Which of the following listed might cause this disease? Okay, so let's think about boring and non-boring mites. So how many of you think that this is boring mites? Okay. So Seropti is it boring or non-boring? Cropti, Natodarus, Demodex, hair follicle, Caltella. So what your answer is? A, B, C, D, or E? A. How many says A? How many says B? How many says C? How many says D? How many says E? Okay, most of you says C, so answer is C. Okay, so which of the following mites reside into the hair follicle and cause localized or generalized dermatological order in dogs? So we are talking about the mites in the hair follicle. Calitella, E, Sarcopte, Autodact, Seropti, Demodex. Great. So Demodex, always in the hair follicle. Okay, so which of the following mites reside into the rabbit ear canal? So A, Seroptic scabi. B, Chiroptic bovis. C, Seroptic caniculi. Yes. Autodact senatus. No. Okay, so answer is C. Seroptic caniculi is the most common mites in rabbits and reside into the ear canal. So, okay, so yeah, we have done. So, yeah, so any question? Any question? Anyone has any question? No? Okay, so now we have done the review session for the mites. So I just a little bit changed the strategy. We can do the review session soon after the finishing of the mites, and I will do the review session of the ticks just on the last lecture of the tick, that is control strategy for the ticks, something like that. So we'll be do the review session of ticks. So then you will be easily make your preparation better, that you get the review session right away along with that falling ectoparasite. Okay, great. Thank you.